8:06, we want to get to a health alert and a story that has a lot of you talking. Actor Olivia Munn announced her breast cancer diagnosis this week, letting her supporters know about her double mastectomy. She opened up about her health battle over the last year. Well, she urged women to ask their doctors for a test she says saved her life, a breast cancer risk assessment. Joining us live to talk about this is the chief of the breast surgery program at MedStar Georgetown University Hospital, Dr. Lucy De La Cruz. Dr. De La Cruz, we appreciate you being with us this morning. I want to start with this breast cancer risk assessment. It's something that a lot of us really heard for the first time this week. Can you walk us through what this is? Is it a checklist? Is it a test? What does that look like?
Thanks, Marcella, for having me this morning. And yes, it's gotten a lot of attention, and it's something actually we do often in our office. It's called a therapeutic score assessment. It is a online validated tool that we do for patients. It's looking at women who have a family history of breast cancer and ovarian cancer. It looks at density in their breasts. It looks at also BMI, about also their reproductive history, as well as other factors that are also inputted in. Now, one of the things that I always tell patients that it depends on their data that they input. If it's something that they maybe have questions about, it's better if it's done with a clinician rather than them at home, because sometimes they put data that is not really accurate and it gives them a skewed answer. And then maybe that risk score is not accurate. And it kind of maybe either it gets it too high or too low. We do it often for patients. It could start to be done at the age of 25 for patients, and then we can get it to where patients are either at high risk or at an appropriate risk where they start their mammography at 20. At 40.
Okay. And when you get your score for this assessment, what does that score mean? What should you do with that number essentially?
So the average woman's lifetime risk of having breast cancer is 12%. And there are women who have a mutation. So when they get genetic testing, they're at elevated lifetime risk of up to 60 to 80%. There's the women who don't have a genetic mutation that are in between, who have a family history, who have multiple breast biopsies or have dense breasts. And that's the women who get this risk assessment or who actually benefit from getting this validated assessment. And those are the women who, if they're at elevated risk, which means over 20%, would be getting MRIs or be getting an additional screening. So meaning mammography plus MRIs, or now we have the contrast enhanced mammographies.
And we've got about 30 seconds left. I know that, this tool, a lot of people have been talking about it. There's a lot of information out there. Is this tool right for everyone? What else should we be doing to kind of be proactive about our health?
So I would say if you've had all these things that I mentioned before, multiple biopsies, if you have a family history of breast or ovarian, if you have dense breast, this is a tool that works for you. You should ask your clinician to do it, OBGYN, your primary care physician. And if they don't feel that is something that they feel comfortable doing, you should see a breast surgeon. This is something that's also online. I would say that you should see a clinician to do it rather than you kind of going in there and filling in some information, because I've had some patients who do it and they get it wrong just because they input things that are not appropriate. Now, if you get mammography at our institution, you already have all the information inputted when you are on the waiting room and they ask the questionnaires and you'll get a report at the end of your mammography report. So it's kind of pretty standard in our institution when you get a mammography report. But already at that point, you're already getting a mammogram. This is for patients who are not routinely getting a mammogram, the patients before the age of 40 that would benefit the most from getting this validated tool assessment.
All right. That is such great information. Dr. De La Cruz, we appreciate your time and all your insight this morning.
Thank you so much. Have a wonderful Sunday.